So with this, we have concluded the primary skin lesions that were all present on the mind map, and we've gone through the differential diagnosis, and we've done everything that we needed to do with all of these skin lesions. We went through all the primary skin lesions, we described them, we looked at the differential diagnosis, we looked at the clinical features associated with differential diagnosis and how to differentiate among all of those diagnoses. We looked at their treatment and management for the most part, and we described all of them in a nutshell. So now we move on to the secondary lesions, which are not present on the mind map, but we will just briefly describe them just to be able to identify them. So what is excoriation? What is excoriation? Excoriation is basically a superficial, often linear skin erosion caused by scratching. What is lichenification? So lichenification is basically dry, leathery thickening of the skin as a result of chronic inflammation, and sometimes there is scratching, but sometimes there is other exacerbating factors, for example, inflammation that leads to lichenification. So what is ecchemosis? Well, the other name is bruising. So we all know what bruising is. This is basically extravasation of blood as a result of trauma or other things that spreads into the superficial layer of the skin. So what is a scab or a crust? It's basically dried exudate that spreads into the superficial layer of the skin, and it's usually a part of the healing process. So you see a scab, you know that something happened to the skin earlier and now it is just healing. What is edema? Edema is just swelling of the superficial layer of the skin because of water exudation in that area. Water where it should not be. What is a scale? Scale is basically just small epidermal cells that accumulate on the top surface of the skin, and they look like scaly. So what is a crust? It's very similar to scab. So basically there is a dried exudate of fluid. So this may be blood, sebum, or other things that just accumulate, or purulent material that accumulate on the top of the skin. So we call it a crust. And it's very similar to scab actually. What is a fissure? Fissure is basically splitting of the skin into the deeper areas. So fissure can be present on the hands whenever there is more trauma involved and there is an underlying condition. So for example, dry scaly skin, when there is eczema, for example, and just becomes very severe, there is going to be superficial splitting of the skin, and we call that fissure. Fissure can also be present in other conditions, for example, systemic conditions, ulcerative colitis and stuff like that. So whenever it's present, of course, we need to manage it, but it's a secondary lesion. What is a scar? Scar is basically just a fibrous tissue that replaces the normal skin, and it happens as a result of response to initial trauma or initial injury or inflammation. So it's going to cause some disfigurement, but it's going to try to maintain the integrity of the skin. That's why it forms. So essentially, it is a part of the healing process. What is an erosion? Erosion is basically just superficial loss of skin integrity. So it is just one step short of an ulcer. So superficial loss of the integrity of the epidermis, and when it becomes bigger, then we call it an ulcer. So what is an ulcer? Ulcer is superficial loss of epidermis extending into the dermis. So whenever there is an ulcer, there is deeper loss of skin integrity. So both epidermis and dermis are involved. So whenever we see that, the skin is going to heal to maintain its integrity naturally, and then it will form a scar. And ulcer is on the mind map because there is differential diagnosis associated with ulcer. And of course, we already discussed them, like the squamous cell cancer and other types of things. But this is basically how we define ulcer. So cysts are basically enclosed cavities that contain a liquid or semi-liquid material, and cysts are going to basically involve all the layers of the skin, not just the superficial layer. That's how we differentiate between the cyst and the nodule. So what is purpura? Purpura is basically superficial lesions that do not blanch. So these are red purple lesions that don't blanch under the pressure. So when we press the skin, it's going to just kind of stay there. And these are going to result from extravasation of blood from the surrounding cutaneous vessels into the skin. And the purpura lesions are going to basically be flat, or they're going to be a little bit raised. Petechiae are small, less than 2 millimeter purpuric lesions, and petechiae usually are formed as a result of underlying blood vessel disorder or platelet disorder. So with this, we have concluded this material and the presentation that went along with it. So as you can see that we went over all types of skin lesions, the differential diagnosis associated with skin lesions, and we covered all the material. Now we have reached the end. If you have any questions, please feel free to contact me. Here's my email. Reach out. If you have any comments, then also contact me. I'm happy to engage with you, and I hope you enjoyed it. I hope this was helpful and useful. As I said, skin is the biggest organ in the body, and one presentation can never, by no means, do justice to this material. But I hope that the material contained in this presentation was good enough and it sparked your interest in dermatology. Thank you.